Today, we are going to cover 3 simple walking techniques that go beyond the ordinary as we unveil 3 simple yet scientifically backed walking methods that can turn a stroll into a potent health booster. Are you curious to find out how a few tweaks to your daily walk can make a world of difference? Such as reducing your blood sugar levels, increased caloric burn, and relieving lower back pain, just to name a few. We'll also talk about when is the best time to take a walk after a meal. Keep watching to uncover these innovative strategies and learn how they can lead you to a healthier, more vibrant life. The first is interval walking training. Interval walking training, or IWT, is an innovative exercise method that alternates between slow and fast walking intervals. Developed by researchers at Shinshu University in Matsumoto, Japan, IWT has been shown to significantly improve health metrics compared to regular walking. IWT involves alternating between slow and fast walking, offering more than the conventional step-counting approaches. Studies conducted in Matsumoto, Japan, demonstrated that participants engaged in IWT experienced significant health benefits compared to those who walked 10,000 steps daily or did no walking. Over 5 months, the IWT group exhibited a decline in systolic blood pressure 4 times greater than the 10,000-step group and a 2.5 times greater reduction in diastolic blood pressure. Sustaining these results for 5 years could potentially reduce stroke risk by 40%. Moreover, IWT has shown to lower depression indices by 50% and improve sleep efficiency by 12% in middle-aged and older adults with depression symptoms. Research led by Professor Masuki Shizue from Shinshu University has revealed that IWT can significantly improve physical strength. Participants in the IWT group showed a 12% increase in hamstring muscle strength and a 10% increase in aerobic endurance compared to those who walked 10,000 steps daily. Shinshu University's team collaborates with local hospitals to integrate IWT into cardiac rehabilitation programs. Patients, such as those recovering from myocardial infarction, have experienced significant improvements in their ability to walk and perform daily activities. The ease of incorporating IWT into daily routines and its remote monitoring capabilities make it a practical solution for heart disease patients, leading to better long-term health outcomes and reduced medical expenses. IWT's potential extends to managing diabetes, as shown by research from the University of Copenhagen. Middle-aged and older participants with diabetes who engaged in IWT saw a 10% decline in blood sugar level variability, indicating better diabetes control. To properly perform interval walking training and achieve the best results, follow these steps. Number 1. Warm up properly. Start with a few minutes of light stretching to prepare your muscles and joints. Focus on your legs, hips, and lower back. Number 2. Follow the IWT basic method. Following are the steps to perform the IWT method properly for maximum effectiveness. Number 1 is slow walking. Begin with a slow, relaxed walk for 3 minutes. This should be at a pace where you can comfortably hold a conversation. Number 2 is fast walking. Transition to a brisk walk for the next 3 minutes. Increase your pace until you are slightly out of breath. Your steps should be longer, and you should swing your arms vigorously. Number 3 is alternation. Repeat this cycle of 3 minutes slow walking followed by 3 minutes of fast walking. One set includes both a slow and a fast interval. Aim to complete 5 sets of the slow-fast cycle, totaling 30 minutes per session. For optimal benefits, practice IWT at least 3 times a week. Using a heart rate monitor can ensure you maintain the desired intensity during your walking sessions, while tracking the duration and your perceived exertion level can help monitor progress. To get the most out of your walks, maintain good posture by keeping your back straight, shoulders relaxed, and eyes looking ahead. Stay hydrated before, during, and after your walks, and wear comfortable, supportive shoes designed for walking. An essential exercise for individuals who walk regularly is the anterior tibialis raise. The anterior tibialis raise, often referred to as the toe raise, is an effective exercise that targets the muscles in the front part of the lower leg, specifically the tibialis anterior. This muscle plays a crucial role in dorsiflexion, which is the action of lifting the foot towards the shin. According to a study published in the Journal of Aging and Physical Activity, strengthening the tibialis anterior has numerous benefits, particularly for older individuals, as it improves the ability to lift the toes while walking, reducing the risk of tripping and falling. Additionally, a strong tibialis anterior can help prevent common lower leg injuries, such as shin splints and strains, by providing better support and stability to the lower leg. To perform the anterior tibialis raise exercise, start by positioning yourself with feet hip-width apart and about 6 to 8 inches away from the wall. Lean back so your back rests flat against the wall for support. Keeping your heels on the ground, lift your toes and the balls of your feet towards your shins, focusing on contracting the muscles in the front of your lower legs. Hold this position for about 3 seconds before slowly lowering your toes back to the starting position. Perform 10 to 15 repetitions for 2 to 3 sets, depending on your fitness level. Make sure your movements are slow and controlled to maximize muscle engagement. Keep your knees slightly bent to avoid locking them, and focus on the muscle contraction rather than the speed of the exercise. As your strength progresses, you can make the exercise more difficult by increasing the distance between your feet and the wall, as well as increasing the number of repetitions. To reap the benefits, incorporate anterior tibialis raises into your regular exercise routine. Aim to perform them at least 3 to 4 times a week. Postprandial walking. The second method to maximize the health benefits of walking involves not a specific technique, but rather the optimal timing of walking after a meal, which is known as postprandial walking. Postprandial walking refers to the practice of taking a walk shortly after consuming a meal. This type of walking is done to help manage and reduce post-meal blood sugar levels. Studies have shown that walking after eating can enhance glucose metabolism and improve overall digestive health, making it an effective strategy for maintaining healthy blood sugar levels and promoting general well-being. According to research published in the Springer Journal, taking a walk for just 20 minutes right after eating can significantly lower blood sugar levels. Waiting too long to exercise after a meal reduces this benefit, and exercising before a meal doesn't have the same effect. This is particularly important if you have a sedentary lifestyle, especially during work hours or in the evening when your body is digesting food and would otherwise store excess carbohydrates. Research shows that post-meal walks help manage blood sugar spikes in both healthy individuals and those with type 2 diabetes. While the long-term benefits are still being studied, previous research suggests that lowering post-meal blood sugar can reduce the risk of inflammation-related diseases like type 2 diabetes, non-alcoholic fatty liver disease, rheumatoid arthritis, and cardiovascular diseases. For people with type 2 diabetes, walking after meals might improve long-term blood sugar control and reduce future health issues. So, to get the most out of your meals, it's best to take a walk right after eating. The third method is walking backward. Walking backward, especially on a treadmill, might seem unconventional, but it offers a range of health benefits that can improve overall fitness, enhance rehabilitation, and support cardiovascular health. This practice engages different muscle groups and challenges the body in ways that forward walking does not, providing unique advantages for individuals of all fitness levels. Backward walking on a treadmill is considered safer than doing it outdoors or on a track because treadmills provide a controlled environment with a stable, flat surface free from obstacles. This reduces the risk of tripping over uneven ground or debris. Additionally, treadmills allow precise speed regulation, enabling gradual adjustments that help maintain balance and minimize the risk of falling. The presence of handrails offers extra support for maintaining stability, which is particularly beneficial for beginners or those with balance issues. Moreover, the indoor setting of treadmills protects users from outdoor elements such as rain, wind, and extreme temperatures, further enhancing safety. Let's take a look at a few of the surprising benefits associated with walking backwards. Improved muscle strength and flexibility. Backward walking activates the quadriceps, hamstrings, and calves more intensely compared to forward walking. This enhanced muscle engagement helps in balancing muscle strength across the legs, reducing the risk of muscle imbalances and related injuries. Additionally, the movement pattern involved in walking backward stretches the hamstrings and calves, increasing their flexibility and range of motion. Enhanced balance and coordination. One of the primary benefits of walking backward is the improvement in balance and coordination. This activity requires greater focus and spatial awareness, which helps in developing better overall body coordination. For individuals recovering from injuries or surgeries, such as stroke survivors, backward walking can aid in resetting gait patterns and improving walking symmetry. Increased caloric burn. Walking backward on a treadmill can significantly increase caloric expenditure. The effort required to maintain balance and the engagement of additional muscle groups result in a higher metabolic rate. According to the American College of Sports Medicine, backward walking at a moderate speed burns more calories than forward walking at the same pace, making it an effective exercise for weight management. Cardiovascular benefits. Research indicates that this form of exercise demands more oxygen and places greater stress on the cardiovascular system, leading to improved heart and lung function. This makes backward walking a valuable addition to any fitness regimen aimed at enhancing cardiovascular endurance. Rehabilitation and pain relief. Backward walking can be particularly beneficial for individuals with lower back pain or those undergoing rehabilitation. The movement reduces the load on the spine, alleviating pressure and potentially reducing pain. It also encourages an upright posture and better spinal alignment, which can further alleviate discomfort. For those recovering from lower extremity injuries or surgeries, backward walking offers a low-impact way to rebuild strength and flexibility. Unlike forward walking, which can place significant stress on the knees and joints, walking backward tends to reduce this impact. This makes it a suitable exercise for individuals with joint pain or arthritis, as it allows them to stay active without exacerbating their condition. When starting backward walking on a treadmill, it's essential to follow a safe and effective protocol. Begin with a low speed of about 1 to 2 miles per hour and short sessions of 5 to 10 minutes, gradually increasing the duration to 20 to 30 minutes as you become more comfortable. Incorporate this exercise 2 to 3 times per week. Always start with a warm-up of forward walking for 5 to 10 minutes and end with a cool-down to prevent injury. Use the handrails initially for balance, maintaining an upright posture with your core engaged, and ensure the safety lanyard is attached to your clothing. Keeping the treadmill at a low speed until you are confident will help maximize benefits and reduce risks. And as with any exercise routine, it is recommended you consult with your healthcare professional. Thank you for watching.